All right, 5:32.
All right, well, let's call the March 14th meeting of the Common Council's Community Wellness Committee to order. So roll call, Mark Davies, I'm here. Luke Murphy, I'm here. And Emily Falco cannot be here tonight. Also in attendance are our chiefs, Wittenberg and Knapp. Thank you, chiefs. And Dr. Georgeson and Mayor Drenner. So any problems with the minutes from February 17th? They were very detailed. Our thanks to Bonnie on that one. No, thanks to Bonnie. Okay, so let's get to the topic. So, I guess Chiefs Wittenberg and Matt just wanted to hear from you about some of the public safety concerns that might be out there, in particular the homeless. We've been hearing a little bit about that may have kind of been a source of maybe increased focus over the last month.
About 2 weeks ago, I was contacted by the warming shelter to ask if we might be able to aid them in their mission to provide a safe and warm place for the homeless during the overnights, for people that are either unable to fit in because they're booked solid, or that they have been banned from every other place that they've been. And we've been consistently seeing between 1 and 4 people a night in our lobby, which is okay for now, but also a bit of a cause for concern, as we also have people that come in at all hours to be coming in for business reasons, some of them with children, and if it becomes disruptive, then we're going to have to change track. But at this point, we've been able to accommodate some of their overflow needs.
So, do you know offhand how many beds that the warming station has? Is it usually capacity, or is it usually the second part being banned from?
I would say it's a combination of both, and no, I don't off the top of my head know how many beds that they have there. I think it's 8.
Okay. Have there been any problems from that, or is it mostly just been, there's just been an increase of?
Aside from some people expressing that they were surprised when they came in and saw people in the lobby, there haven't been any to speak of. However, you know, that can change, and I've left it up to the sergeant's discretion as to whether or not to become disruptive, or they're leaving messes, or there's some other issue, then they'll be asked to leave.
And how about the breezeway between the parking lot and Main Street? Has that been?
We've done a pretty big uptick in walkthroughs and enforcement of people that are there for extended periods of time and creating disruptions. So there should be a marked decrease in complaints from the walkway.
And Chief, in your experience, I mean, you know, it's kind of nice, we're heading towards warmer weather. Do you think there will be fewer people in the warming station, fewer people that are in the police station there, or is that something that will continue even with the warmer weather?
If there's access to electrical outlets, we find that people that are undomiciled will often find an outlet so they can charge their cell phones, which creates congregation. Sometimes they'll fight over the outlets. That's not legal. It's theft of services. You can't just plug in and decide that you're going to run your stuff off of taxpayer funded electricity. So in some instances, we've put locks over the outlets to try to mitigate that.
I would just add to it, like we've with 195 Main Street kind of being in limbo, and then I think it's 195, 203, that whole section right there. We've been doing with the codes office pretty frequent, well, I wouldn't say pretty frequent, but like I'm trying to get my guys in there to become more familiar with the building, because it's to us a very high hazard right now, because a lot of the fire suppression system is off, the fire detection system is off to large portions of these buildings. And we're finding rooms that have people's belongings in them, and actually I found 2 separate times squatters staying in one of the buildings, in one of the specific rooms, and he's been kicked out, but continues to come back. So I think that, well, we might not see individuals maybe at the warming station because the temperature doesn't allow them to go there, they're gonna have to go somewhere, and they're gonna find places like this, in my experience, to try and find a place to stay.
That's the case with any vacant building within the city. We've had instances where fires have been started and in one case, the whole house burned down by 2 homeless people on Webb Island. During the summer months, the drive for people to find shelter is lessened, but there's also an increase in transient people passing through Oneonta simply because of the weather. It's really hard to say, but they're here. We've discussed some reasons that have been given to us in the past as to why they end up coming here. Central New York seems to be an area where assistance tends to go further. So they seek out that assistance that, for lack of a better term, just spreads a bit further when they're in Central New York as opposed to more metropolitan areas throughout the state.
Do folks tend to come here and kind of stay here for a while, or they just kind of stay here for a bit and pass through?
No, we have somebody right now that has been here for over a year that continues to be homeless and has refused services and has been doing this, I think I mentioned last meeting, 17 years.
With that said, there was another individual, I think, that talked about this, that we would like to question him in relation to a fire on Chestnut Street, but between the police department and fire department, have been unable to find him. And so that fire cause has gone undetermined at this point, but still is under investigation.
For the folks that are transiting between the months, is it, do you find it the case that a lot of the times it's the same people going from place to place, or it's a whole entirely new group of folks every time?
There's really no rhyme or reason to people that come through. We are often surprised by the distance that people will come to live in Oneonta, and for no reason other than like literally throwing a dart at a map of New York.
So it sounds like we have 2 kinds of challenges. We have one is those transient folks who might kind of come here, how do we address their needs? And then the folks that might be here and might be in and out of housing for different reasons. Different needs or different people.
Many, well, I think there's a common thread for a lot of them, is many of them have mental health issues and addiction issues that they choose to neglect or can't see as being a problem. So without us being able to do anything, so I think I mentioned at the last meeting, with the jails being closed, we have no single point of access for services through mental health or addiction recovery. And nobody in mental health services will treat anyone that's got addiction issues until they've sobered up from whatever their addiction issues are. So there's no avenue for us to do that. There's nothing written into the law for people that are in addiction crisis as opposed to mental health crisis.
Sorry, just trying to keep notes on that. And then I think I asked you this last time, but just I've seen that several folks I would think are probably living out of their cars. Is that also something you keep commenting about too?
We have in the past. I can't speak. I'm not on patrol often, so I can't speak to actually seeing someone that I would suspect as being homeless. Oftentimes that's difficult because they just won't say that they are homeless. They'll just say, no, I've just got a messy car. There's, I think, to some degree, a bit of pride in not seeking help for whatever reason, and, I'll figure it out on my own.
Right. All right, any other news for us? Well, that's all sobering. Thanks, Chief, appreciate it.
I can say that I've been contacted by a refugee relocation specialist out of Utica. That'll be at our next meeting for discussion. There's some locally interested folks in relocating families here to Oneonta and sponsoring some of them. The center won't sponsor less than 50. So we invited the specialist to come and speak at the solutions panel so that they have an idea of what services are available. I think that there should be some frank discussion on what the capacity is for the community to provide intensive services for people that may be in acute need, whether it be from post-traumatic stress, and then there's language issues to boot. So the school systems would have to be involved in that in some way, as well as mental health and, family services, social services. So I just wanted to bring that to your attention if you didn't know already that there's some interest in that.
And that's to discuss at your community solutions meeting next month.
2 weeks,
It's every 2 weeks.
every 2 weeks.
Okay. And Chief, can you keep sending, I guess, if you wouldn't mind, all three of us, a link to that, and that way, I'd like to make sure that one of the three of us can try to get there in time, so if possible.
Okay, yeah, we can send somebody a link.
Yeah, right, I'm sorry. I don't know if that's okay with you, Chief, but just, I feel like there's such tie-ins there, it'd be really good just to be able to kind of listen to what's going on in that particular level, if you're okay with that.
Yeah, I think, as local elected officials, you certainly should be involved in the conversation regarding resettlement. There's you're talking really intensive services in some instances with people that are here speaking English as a second language, children in need of educational services, mental health and hospital services, doctors. I mean, there's a lot to consider, and I just don't, 50 families full-time, given the strain that Otsego County Mental Health and Social Services are under currently, it's a big ask. I just don't know how they would manage it. So I know that there's probably going to be some call for additional support.
And so those would be the kind of preliminary discussions about whether we can handle that.
We're going to handle whatever we're given. I mean, we can't make a determination as to who's going to come here, when, or, whatever. I think there needs to be some frank discussion so people understand what it is there is available for people. Because the last thing that I think any of us want to see are people that are relocated someplace where there isn't available support for them.
Right. Absolutely.
So is this the same group that Deb Marcus has been working
Yes.
with?
Yes.
Okay.
And are these particular refugees, are they refugees from Ukraine, or could they be anywhere?
They could be from anywhere.
I think the focus is on Afghan to start.
Interesting challenge. I don't know how many Arabic speaking folks we have in this community to be able to support them.
And religious support's also a concern, right?
Right, yeah. Right. Good, thanks, Chief. Appreciate it. So survey, Luke.
Yeah, so thank you, Mark. I was working on this. I did the best I could with it. I'm not a statistician. I did some research into what kind of questions to ask. My girlfriend helped me out with it a little bit. She's doing a PhD in economics and is working on a lot of surveying, so that the things look a little more technical. That's her. I know Emily's not here, but she had a question about the open-endedness, and I think it'd be probably good to talk about it. My thoughts were there is a lot I don't know, and I'm still learning every time both of you report. I feel like I've learned a lot. So that's one of the reasons why the questions are so open, and also why I decided to do between 10 and 15, as to not overload I was envisioning us sending these to some of the partners that we talked about, some of the contacts that we have in the community. But am more than happy to hear your feedback on it. I know some of you just got it, so I don't want to put anybody on the spot, but whenever if you feel like you'd like to, by all means. So I try to keep it vague, not vague, open. There's no multiple choice. Really just trying to not bias anything. My fear was if I personally put multiple choice on, without input from anybody here, I would be biasing with only what I know, and I know there's a lot I don't know. So that's why it's so open.
Yeah, I don't have any problem with the open-endedness. Personally, I think that it keeps, it's a little bit more difficult to collect the data, right? So you got to sift through all the responses and kind of find the common thread between them, as well as kind of begin to aggregate everything, look at it. But it does allow us to we're trying to get at what the problems are, as people with open-ended questions might begin to produce some thoughts that we haven't considered, some problems, a deficit problems we haven't even thought about. So I think that would be fine. I guess my one thinking is how do we begin to do this, and how do we deliver this? I don't know how people feel about it, but I think the days of handing a paper survey to people and getting it back are kind of over. I think we need to look at some online mechanisms, and there's some good ways out there to do surveys. That Google Forms has got Google Forms and things like that, which would be good. But
And I do work with a lot of, it's a little bit less heavy, but surveys for work using, I have a lot of good luck with certain as well as Google Forms too. It's really easy to set up and send out.
right.
So I'm happy to do that once everybody's kind of on board with the questions.
Sounds good.
Yeah.
And then the other challenge would be, of course, and I've been running the challenges, is getting email addresses for folks.
Yes.
Which sometimes is not the easiest thing, because the people out there, we know them, but their email is not even accessible at some of their workplaces, so they're a little difficult. So I think that might be a challenge. Ben, did you want to mention anything about the?
Yes, but first I want to say I think this is excellent. And my only feedback would be, I guess, being clear about how one describes the community, because, in 5 and 6, it says on the Onyx community, and then, some of the organizations you survey may be serving the county, they may be serving town residents. So I guess if I were answering this, I'd want to make sure I knew what you were defining as community. And I know there's more, I understand there's overlap, so there's going to be overlap, but maybe to help clarify that. But I think these are excellent questions. But now, did you want me to talk about the other thing, or was that?
In terms of, I'm sorry, in terms of what we just talked about as we were kind of.
Yes.
Sure, would you
Yes.
talk about that?
Well, first, so I had a very instructive discussion with Dr. Reggie Knight, who will be the incoming CEO, president of Fox Hospital. And he's very looking forward to working with the city, looking at population health. In fact, unbeknownst to me, Bassett has been designated to facilitate New York State Department of Health, the Bassett Research Institute specifically has been selected by the New York State Department of Health to organize and facilitate population health efforts in the Mohawk Valley region, which of course, as you know, includes Otsego County. So I think Reggie really did want to reach out to us to partner with us, both in figuring out what the needs may be and maybe providing mutual resources to address them. Thus far, they have recognized 3 current priorities. I'm not sure what that process entailed, but if I look at their website, it says that those 3 priorities are mental health, which we certainly could, that seems to be an underlying issue for us. Obesity, so I think that's more within the healthcare realm, but certainly an issue, and opioid use. So, and then the only other thing I found helpful looking at this site, this population health site, is they had one graphic where they actually sort of spelled out, what do we mean by population health? And they even indicated this was synonymous with what we've talked about as social determinants of health. And I'm not sure, the model referenced was from, I think, the University of Wisconsin, but what it said was this: 20% of population health has to do with healthcare, meaning access and quality, which we talked about. 30% has to do with health behaviors, which, addictions may fit into that. I think there's probably overlap there, but also, diet, smoking, things like that. 40%, so the biggest piece are socioeconomic factors, and I think we recognize that. And that speaks to homelessness and food security and all those other things we've talked about. And then 10% physical environment, which I guess also could have to do with homelessness, but also other environmental health issues, which I think fortunately as a community, we don't really have too much, pollution and exposures and toxic exposures and things like that having to do with the physical environment. I think we have a beautiful physical city, but anyway, I will send you all that link. I sent it to you, Mark. For me, it was just a nice way to begin to look at, what do we really mean by wellness? Because I think we've talked around all these things. And hopefully we can, hit on some projects that can really do some good. And I think having Reggie here talking to us, sort of explaining what this process has been like for them and help instruct us. So I will invite him to our April meeting.
Yeah.
And I'll send you all the link to that site.
Thank you for speaking with them. Just a few questions though for you in terms of that. So this initiative that they're working on, what's the scope? Is it really right now a needs assessment, or is it needs assessment followed by beginning to have kind of educational or policy that they're going to create to be able to address these areas? Or
I think it's meant to be action oriented. I'll read you directly from the site. It is the job of the Population Health Improvement Program to help New York communities to begin addressing the health behaviors, the environmental and socioeconomic conditions that have proven to be the major factors determining a population's health. So again, it's very broad and overriding, but seems again to be very similar to what we're kind of trying to achieve here.
Right.
So I think, yeah, they're beginning with some community needs assessments. But then it looks like they've already chosen some priorities. So I think it has both to do with figuring out what's needed and also having some actionable programs to make things better.
that sounds good. I mean, I think we've clearly talked about the magnitude of this challenge, and I think if we're able to work closely with, some of our community partners, which we'll discuss in a little bit, but also Bassett and the new CEO, I think that's it's a great thing for the people to think about how we might, kind of collaborate on our efforts and meet some of the different needs. And those certainly need our needs as well. Good, thank you. I think another thing, thinking about the survey, my apologies, what is our timeline? What do we think the timeline for this?
I say sooner the better. I can get this into a survey generator, facilitator, whatever you want to call it. As soon as I heard Emily's feedback. It sounded like yours was good. If the chiefs want to look over it, see if anything pops into their minds, at any time. I mean, I can have this after our meeting.
Sounds good. I think it's just a matter of like, when do we want to have the cutoff, maybe goes for a month or something like that?
Yeah,
Or
obviously.
Right, no, so yeah, what's our timeline? How long do you want to keep it open? I guess is the question.
Month might be good, maybe. I'm just wondering if we leave it open for a month, if folks will almost forget about it.
Yeah.
But I don't know if 2 weeks is too short. We could do a month and I could send out every maybe, I don't know, at the 2 week mark, if it's another reminder to the folks that I haven't heard from yet.
Okay.
Yeah,
We might need to put some time into kind of collecting all the emails as much as possible. Well, you know, I think we all probably have different email
Yes.
addresses. Maybe we can try to collate all their efforts to be able to see whose emails we have access to and who we might need to. I hate to drop this off at a, you know, like in the main link of an organization that just kind of goes to a general central. It's better to be able to target, you know, particular people in the organization. So, yeah. Okay. So maybe you want to think about, another week, can pull all together that email.
Yeah. Absolutely, and I know, I can't remember if it was you or Emily that was working on that. We had, I don't know if it was quite a spreadsheet, but I'm happy to start kind of doing some digging through the names through Google and everything else and see if I can find a more direct contact.
Sounds good. And I'll do the same then if you want to let me know which ones to work on.
Sure.
As well.
Any that you find yourself unable to get addresses for or something.
Thanks, man.
Okay, yeah, there's a couple of them already. I've been struggling with a couple for the advisory. So I want to send it to you if you've got any of these. Some of them are fine, others not. So. Great. So Emily is not here clearly, but she did quite a bit of research into some other communities. I was off this weekend and on the road all day today, so I have not had a chance to really read this over. So I'm just kind of reading through it very briefly today, but it looks like she has looked at some programs here. One for program for homelessness and addiction, which can be consistent with you with what you've said in terms of those paired issues. She talks about some different housing for homeless folks, housing homeless folks in backyards, so people can be able to have little, but in terms of people struggling to make their mortgage while also providing homeless families with a place to live, so that's interesting. Bottom line is there's quite a few different ideas up here that she has gathered from around the country, several from New York, Buffalo, Syracuse, Newfield. So I think we'll have to give this some time to look at it. Maybe we can also make this one of our first things for next meeting is have her kind of report back what we've got going on here. And we can take the time to dig into this and take a look at all these different places. And she was at the meeting you had Thursday as well?
Yes.
Okay, good. How'd that go?
It went pretty well. We just discussed very closely the things that we've discussed here today. Some more of the, as far as introductions go, and basically what we've managed to accomplish through the solutions panel. Some of the accomplishments that we've had. I think more than anything, it's been a conduit for us to establish relationships across disciplines. So it's been really important.
Yeah, sounds like it. And I keep thinking I think we need to just stay as connected with what's going on there, the conversation is there, because they can certainly inform here. It's, why, if you've got really great conversations taking place there, we should be able to.
Sure, in a broader scope, some of the things that we discuss are individually focused and confidential regarding individual people. So, as far as the next meeting, it's specifically set up for the refugees and how we might be able to support the mission of the group that's trying to bring them in. And, we want to make sure that people have a really good idea of what we have here and what we don't.
Right. Well, then maybe we'll just leave it to you if you feel that there's something that'd be on the agenda that would be valuable for us to.
Yeah, absolutely. Yeah, I would certainly. And I, keep you up to date. I've spoken with the mayor several times regarding what it is that we're working on. And a lot of it is just dealing with individual problems and not to get wrapped around the axle, but some of them are pretty significant. And we've had some successes, but unfortunately, one issue that we had that emerged last year around July was a specific elderly adult male that bogged down both the police department and fire department and Fox Emergency Center as well as Bassett. And the only way that we were able to resolve the issue was through arresting him repeatedly, because 2 attempts at getting some sort of court process to get him, to get the help that he needed failed, because the unfortunate reality is that people have a constitutionally protected right to do what they like to do, and unless we revoke those rights, they can continue to do it. The only way really to revoke those rights is through criminal process and court order. Anyway, he was arrested, subsequently sent to jail. The jail recognized that he needed a higher level of care, sent him to a state facility, and his charges have been since dismissed. But as far as I'm aware, he's still in a acute psychiatric care hospital.
I don't think the average folks knows what you both deal with, you know, the types of.
No, we've sat and spoken about the resources that were expended on this gentleman, trying to avoid him being in the court system, because the correction system is not where he belongs. It worked, but we're probably talking somewhere in the ballpark of $250,000 of salaries between about 30 people through many disciplines, including a doctor in charge of a very large not-for-profit in the southern tier that was the one that petitioned the courts twice unsuccessfully.
Thank you. So I guess the only last thing here to talk about is not the last, the advisory group. So I think I sent you all, I think I sent you as well. Actually, maybe not the most updated, but I did see a couple emails here, but the advisory group has been building and growing here. So this present there is, let's see, 1, 2, 3, 4, 5, 6, 7, 8 people. So we have representatives from SUNY Indiana, Harvard College, a nurse practitioner specializing in addiction, one of the Otsego County Office of Community Services, someone who's very interested in community health, the Crisis Intervention Director at Opportunity for Otsego, the Program Manager for Catholic Charities Housing Office, the Executive Director of Relief, and a person who is now, as I understand it, a private citizen, but has worked for the last 15 years with Runaway Youth. So it's kind of a assorted, pretty eclectic group of people. There's still some people queued up and waiting to try to contact, because I have no good contact information or emails. So we will certainly try to do that. So I'm kind of excited this is coming together. But I guess I've been struggling a little bit with having these conversations with people. It's been wonderful. We've had great conversations, some great email back and forth. But this group is really anxious to get moving and get doing things. And I always get really kind of self-conscious about asking for people's time, but this seems like a group that's really willing to give their time. So I guess I started playing with the idea of how to best kind of incorporate them into things. I think certainly inviting them to meetings from time to time, or when needed, certainly being able to email them and call them. But I started thinking, is there an opportunity here to have some kind of, I guess it was your summit that you're having here about the Children's Museum kind of got me thinking, is there an opportunity to have perhaps a summit here? And maybe that the city plays a role in having a summit of all these different practitioners. And I don't think that this needs to stop with this particular group. There's plenty of people, maybe there's people in your group that would be, interested. I don't know what the thoughts are, but I'm just trying to play with this. How do we take this energy of all these people that are kind of excited and interested and best harness it? And, I think that I'm glad that we're meeting consistently, but I feel like once a month for an hour, when these are people are dedicating their entire professional lives, sometimes personal lives to this, how do we take that energy and get it in a positive direction? So this is what I'm asking aloud, something I've been struggling for the past couple of weeks on, because I've been having these great interactions with these wonderful people who are so willing to give up their time. How do we best kind of take that energy? And I'm hoping that answer there, and I'm certainly open to thoughts that anybody might have.
I can say from my perspective that if you're inclined to want to look at a summit, I would be beyond supportive of that, and anything that you need from this office.
I appreciate that. Doctor?
I think it's a great idea. I'm thinking maybe you could have, if your intent was to have the advisory group also be those who looked at the survey, you could have them do that ahead of time, and then you could have those answers ahead of time so that they can sort of help guide you through the process of having those discussions and maybe coming to some actionable.
I was thinking the exact same thing.
I'd like to also suggest that, I think we tangentially referenced the post that I put up in support of the police action in the walkway about a week or so ago, which went something like viral in terms of numbers of people who shared it and so forth and so on. I couldn't much monitor anybody else's feed except for the one to which I put it. We could, but it's way too much work. So I monitored that, and in doing, in engaging people in conversation in that particular feed, I found that there were even folks that came in, come with a negative opinion about what's being done or this or that. Most every single person wound up coming around to the idea, yeah, this is a community problem that needs a community solution. And just in looking through that particular feed, there must be a dozen folks in the here right now who self-identified as members of the community who care. So one of the things, as you know, that I'm very interested in doing is bringing voices into the conversation that haven't typically been brought to that conversation. And so with some vetting, I think there are any number of individuals in the community that would not only want to be a part of a summit, but also might be able to bring a perspective that is not necessarily tethered to any particular bureaucracy. And so that alone must be.
Yeah, that you kind of gave me the heads up that you put the email out there. I started getting email from folks that were interested in being part of this and would be able to have the conversation. Yeah, I think there's an opportunity there. I'm sorry. To have some wider discussions, but I guess I'm always interested in trying to think about what's the mechanism to take a wider discussion and turn it into action, right? So the discussions are great, and they're great for understanding what our resources are, what our holes in our resources are, where we might be overlap, what people are doing. Sometimes, and I feel like this is a common problem in this community, widespread on CO and OEM. There's some great folks doing some great work, but oftentimes it's like this. We don't know what everybody else is doing. And it takes kind of getting people together to have these conversations about, oh, really, you're doing that? So that's all great. There's a lot of value in that, but then the what next? How do we turn all this kind of summit into action is always the challenge. Because there's always that kind of energy around the summit, energy around these conversations. But then we get back to our normal lives afterwards. So how do we take that energy and push it in the right direction afterwards? I think is something I'd like to think about a little more. So, I'm sorry.
I think I'm so glad that you monitored that feed and pointed this group out. I didn't even know it was happening. I'm Joel. I'm a pastor here in town.
Nice to meet you, Joel.
Good to meet you. I think what I heard in the list of people that you were getting involved in, I'm not so up on the details of the survey or the group that you're putting together, but I didn't hear a faith-based organization or a pastor or anyone in that. Catholic Charities, Main Street Baptist Church, New Life, which is my church, are all partnering on the warming station. We're in the trenches with the people who don't have housing. We're trying to serve them. And so if you're talking about people who are motivated to do the thing, get some of us involved in that. We'd be totally.
Well, I do have Catholic Charities, but that's not to say I'm not interested in getting more people.
Yeah, yeah.
Absolutely. What we're trying to do is, and it was really a matter of who knew who and who had contacted me. This advisory group, as we imagine it, is to, comprised of experts, people that are doing things out there in the community, I'm not doing, this is not my day-to-day job, if you will, right? So
Right.
It's to have this kind of group of folks together to be able to advise us and give us some different thinking about where to go, what to do, and to be able to call up somebody and say, I've got a question for you, walk me through this, So absolutely, I'm open to whatever you might suggest. And if you'd be interested, certainly we can talk afterwards. I'd like to really get your information.
That would be great.
Or if somebody else you might know or might
Yeah.
recommend. To me, this was this is open to whoever we can get that has expertise that would like to bring to this particular group. I'm not, there's not a, 10 and that's a cap,
Got it.
That's great.
So, I've really just basically been working on who I know and who people have been recommended to me, so I'll keep on trying to work to build this, but the
Yeah.
people that I've spoken to have been pretty excited about getting involved, absolutely.
Yeah, a lot of us have personal relationships with these people on the street, and so we know them, we know their struggles, and a lot of it is what Chief was bringing up. They're addictive, and they're addicted because they have mental health issues. They won't go get the treatment because they have mental health issues, and a lot of them struggle with that. It's a catch-22. It's a circular thing. So we try to treat them where they're at with care and compassion, but there's not too much you can do for them.
Right.
Yeah.
There's less now since bail reform than ever before, which is why we're seeing such a massive increase in people that are out on the street that just don't seem to function well. And there's just no, I mean, a lot of them are people that have been arrested multiple times and are very well known to us, but we have no recourse. There's no ability for us to get them to services, which is what the county jails have been a clearinghouse for throughout New York State. This is not just a community problem in Otsego County or Oneonta. It's a statewide issue that we're seeing major increases in some instances in violent crime simply because we don't have the mechanism to get people to the help that they really need to have. It just doesn't exist anymore.
Right. Yeah. I hadn't thought about the bill reform having that good impact, so it's interesting. Well, I appreciate it. Let's connect here in a few minutes. And we can- we can get your email. Well, if that sounds like it's a good idea, then I think maybe the next, we can throw some email together and figure out when it might be, maybe a nice kind of spring event where we can kind of register people in and.
I think you're 100% right, though. It's not just the gathering of people and hearing their stories, but it's determining some action plans or action plans. They may just be, finding new connections for collaboration that come out of that. But I think that you said it, you wanted to be action oriented.
Yeah, and I was thinking, I was playing with one idea was, could we have kind of small subgroups that come out of this that might be interested in a particular topic, right? So mental health or addiction. I mean, obviously I recognize there's connections there, but that maybe there's a small subpocket of 4 or 5 people that really want to kind of dig into this, and then we can kind of work alongside of those particular groups. I think it's how do we kind of harness the intellectual and compassion capacity of this community to bring to bear this particular issue. And while 3 of us, in terms of council people, are quite interested in this, we certainly, this is a big issue, and if we can be able to, if the role we can play is to facilitate conversations, one of the things we talked about, that's the most important thing we can do. So maybe that's the role, the biggest role of this, this group, this council committee can make is that kind of influence those or facilitate those. So, all right, well, I think we'll need to have some conversations about that. That was really it. In terms of the other thing was just next steps. So we're gonna get this together, try to get you emails in the next week or 2 that we can gather together and get that survey out to people. And I agree, I think starting with the group that we have there, the advisory council or groups.
I actually thought of a couple folks to include on there. And Joel actually sparked my, so thank you.
Yeah, so I want to build that. So Joel, yeah, definitely let's talk. We'll build this out a little more. So at least I think we have a good start here, but certainly not representative of everyone. And there's several people on this list that I have not yet been able to contact. Either I have to be able to find email or only a phone number, and I have a difficulty calling during the day. Usually people are available in nighttime. I have their place at work. So anyhow, I'll try to see if I can try to make some time this week and get some calls with some folks. But yeah, let's build this out.
Yeah.
Get that survey out to them. For our next meeting, then we'll have Emily report in. We'll start to get that survey out and we can have a script of things we can do and look at, be happy to help you kind of collate all that information. There's been a lot of stuff coming in and we might need to kind of pull all together.
Yes.
So that's gonna be April. We're gonna hear from Reggie. It'll be good to hear from him. And then I think we need to try to, again, offline, talk about when we might want to try to do a summit, what's the best time for a summit? And bring those people together, where we want to bring them together, how we want to bring them together, what day we want to bring them, all those kind of questions.
I was just thinking of something, and this might actually be a question for Carrie. If this is something that we're doing, are we limited by time of day or weekend if we're doing something like this?
Specifically reads for boards and commissions.
Okay.
And meetings are outside.
Great, awesome.
And there's no issue with us, three of us, I guess we may here as well, facilitate conversation, there, we don't have any.
You don't have the ability to run a farm to make a decision. So
So we can put this on and facilitate it and all that part of it, how we do that, we don't have to.
we'll announce it publicly just because it's
Sure.
more than for a show.
Okay. Okay, good, thanks. Sound good plan?
Yeah, I feel good, I feel energized about what we're doing.
Yeah, so we're slowly starting to kind of get the view of things.
Yes, yeah.
All right, then I'll call it adjourned. Chiefs, thanks very much for your input, really appreciate it, as always.
Thanks, guys.
Joel, thanks for coming.
You got it.
And give me a second. Thanks very much for your participation.